Glad you are still keeping us company here on Good Morning Kenya. Remember, this is our health conversation for the day, all about UHC. Get to understand it and know what really it means for you as a Kenyan. And with us today to help with this conversation, we have Gilbert Osoro, who is the manager in charge of the Universal Health Scheme at NHIF. And we also have Dr. Andrew Mulwa, who is the Director of Medical Services in charge of preventive and promotive health, taking his notes over there. Now let's get back under the Ministry of Health for that matter. Now let's get back to this conversation. Before we get to further in, let's understand those NHIF packages that you just mentioned very briefly before we now move on to the amendments.
Thank you, Jain.
Yes.
NHIF administers 10 benefit packages that are unparalleled. I want to use that unparalleled because if you look at the contribution vis-a-vis the benefit package, it's a whole world, because we do have the first benefit package, which is the outpatient benefit package. And when we talk of the outpatient benefit package, it includes, among others, consultation with a general practitioner, medical officer of health, clinical officer, psychiatrist, nutritionist, among others. It also includes the requisite laboratory investigation as per the Kenya Essential Package of Health. It also includes drug administration and dispensing. It includes preliminary radiological examination, X-ray, ultrasound, and others. It includes guidance and counseling, family planning, and many others. The second benefit package is the inpatient treatment, whereby you are admitted in a ward. For inpatient treatment, the benefit package includes, among others, consultation with a consultant, general practitioner, clinician, requisite laboratory investigations, drug administration and dispensing, room and nursing care, physiotherapy services, and others. The third is the highly patronized free maternity cover, popularly known as Linda Mama, which has, among others, the prenatal visits, the actual delivery, and the postnatal delivery. In NHIF, we know one thing, that our children are a blessing from God. And the government has been gracious enough to provide a comprehensive cover for expectant mothers. They say this, Mungu akileta mtoto, analeta na sahani yake. So in NHIF, we do cater for expectant mothers. The fourth benefit package is the renal dialysis or hemodialysis benefit package, whereby for members who are ailing from chronic kidney disease, we do provide for 2 dialysis sessions in a week at a rate of 9,500. In a month, we provide for around about 8 dialysis sessions. And the dialysis benefit package, it's comprehensive. It has the requisite consultation with a nephrologist. It has the requisite laboratory investigation, liver function disease, liver function test, and many others, plus the necessary drugs. The fifth benefit package is the diagnostic imaging benefit package, the radiology benefit package, which has the magnetic resonance imaging, that is MRI, computed tomography, CT scan, the new kid on the block, which is the PET scan, whereby we have a collaboration with the Aga Khan, and recently we have empaneled Kenyatta University for people who are ailing from cancer. The sixth benefit package is the surgical benefit package. And when we're talking of the surgical benefit package, it's divided into 3. We have minor surgeries, major surgeries, and specialized surgeries when we are talking of organ transplants. We are talking of total hip replacement, total knee replacement, open heart surgery, and many others. We have the highly patronized oncology benefit package, the cancer benefit package, that among others has one, chemotherapy, and for chemo, for first-line cancer or basic cancer, NHIF is obliged to pay for 6 sessions of chemo, and for every session, we pay up to Kenya shillings 25,000 that caters for our members comprehensively. Under the chemo benefit package, we do also have second line or complex cancer, whereby NHIF is obliged to pay for 4 sessions up to 150,000 shillings per session. And of course, when we're talking of cancer, we do staging, whereby they do an MRI for purposes of carrying out staging.
Yeah.
Under the cancer benefit package, we also have the radiotherapy, whereby we cater for 20 sessions for radiotherapy at a cost of 3,600. If you calculate that cumulatively, it translates to 72,000. And finally, we have the latest kid in town, brachytherapy, which is available in some facilities here in Nairobi Hospital, and cancer care, whereby we cater up to 72,000.
Okay.
The other benefit package is the drug and substance abuse package. We are talking of matters mental health, and you remember we've come from a pandemic whereby matters mental health have been pronounced in this country. In fact, if you look at the papers every day, you see Kenyans either ailing from depression or committing suicide. The good news is that NHIF has a benefit package that caters for drug and substance abuse and mental health. We have the emergency evacuation benefit package, which many Kenyans are not aware, that in the unfortunate event you are involved in a road traffic accident, NHIF is obliged to send an ambulance, whereby we have a program with Red Cross, it's called E+, to send an ambulance to the site of the accident. You will have emergency first aid administered to you to stabilize you. Thereafter, you will be transported to the nearest NHIF empanel facility. And for that matter, we are talking of 7,666 healthcare facilities that are recognized across the country. Finally, we do have the overseas treatment benefit package. In the event you fall sick and the nature of your ailment warrants that there is no treatment available locally, then we can be able to facilitate your treatment in overseas, and the most common destination is India for further treatment. Of course, there are some requisite requirements you must meet. Number 1, the attending consultant should complete an NHIF overseas treatment form. You must get clearance from the Director General in the Ministry of Health, whereby he writes a letter which is known as the no objection letter, that having looked at the nature of your sickness, is satisfied that the treatment is not locally available. You are referred to abroad for further treatment. Then you'll go to the Medical Practitioners and Dentist Council for verification that the referring consultant is a member of regular and good standing who has not only renewed his practice license up to date. Thereafter, you can submit those documents and the NHIF will be obliged to take you abroad for further treatment.
All right. You know, these are processes that, you know, if you haven't experienced, you would never get to understand what it means to just go through this entire process. And once again, we welcome you to share your questions, comments, clarifications. Use the hashtag Good Morning Kenya on Twitter. I will be sampling some of your feedback in just not too long. I can already see them and we appreciate them. The hashtag is Good Morning Kenya. Our official station handle is at KBC Channel 1 and my handle is at Jain Wambui. Now, let me come to you, Dr. Andrew. In line with the delivery of UHC, NHIF as an entity needed to undergo some amendments that, you know, tailor-make it the best delivery vehicle for UHC. Why is this important for you as a ministry to just ensure that you are also, the entity that you are going on board with is in line with the goal and the mission for UHC?
Thank you very much. I think I'll begin by saying that one, for NHIF to be the vehicle that the government thinks, a lot has been undergoing, both at NHIF and also in the health sector service delivery level.
Yes.
And he rightly mentioned that there has been a task force that has been looking at NHIF, making recommendations on how NHIF can be reformed to be best suited to deliver UHC in this republic.
Yes.
And he has mentioned the recommendations in terms of structures, in terms of strengthening some of the issues. And I can assure Kenyans that the NHIF that they are used to. It's not the NHIF that we are talking about. I actually, Gilbert, don't know how we will rebrand in a way that Kenyans understand. The NHIF of yesteryears is not the NHIF that we are talking about. We are
because
talking
the history is there.
A reformed NHIF.
Yes.
An NHIF that's not, we are no longer talking about hospital insurance, but health insurance.
Yes.
So it was necessary to make amendments to the law so that NHIF is made a hospital insurance fund, a health insurance fund from a hospital. And that is the basic of the legal amendments, so that the legal structure, the legal instruments can allow, one, the delivery of services outside the hospital. When I talked about the UHC that this country envisages to deliver is based on primary health care. It is, we are moving from the hospital to the community. And he has rightly mentioned the benefits. How is that possible? That is possible when we have what we call the hub and spoke model, where, like a level 4 hospital, usually serves a network of level 3 and level 2 facilities, health centers and dispensaries that refer to that facility. So we are established the primary healthcare network so that these hospitals can be able to support the level 2s, the level 3s, and the community level 1, so that screening services, by the time you talk about cancer package, you need to first prevent the cancer and make early diagnosis of the cancer. So screening services are now going to be taken care of. Primary healthcare services, you talked about family planning, you talked about immunization, you talked about these services that can be offered at community and lower level facilities are now able to be facilitated. Before we even come to NHIF, it is important that the journey of UHC is appreciated, so that we appreciate it is not just about the money and NHIF. The government in the last 10 years has invested in this journey, and to keep saying UHC is not a destination but a journey.
A journey, yes.
And even countries like Japan that began their journey of UHC in 1922, almost 100 years ago, are still working on improving their UHC. What, in other words, we are saying, when the Jubilee government came in 2012, the first thing that they did is to abolish user fees in level 2 and 3. So therefore, access to health care services in level 2 and 3, which is dispensary health centers, from 2013 has been without pay. So citizens are able to access services without pay. That is part of UHC journey. Introduced the Linda Mama as free health maternal services is a journey towards UHC. In terms of health system strengthening, through the UHC, during the pilot and immediately after the pilot period, we had a phase where we were strengthening the health system. The health system includes issues of human resources for health. I think we have engaged across the country close to 14,000 new healthcare workers to support UHC as part of health system strengthening. We have issues of health information systems. He's talking about biometric registration of persons or of beneficiaries. So that is part of UHC, because we want to have a system that identifies the clients, removing the issue of duplication, removing the issues of fraud, the issues of we are talking about support in health products and technologies. We have developed a list of products for laboratories, for drugs, for non-pharmaceuticals, essential packages, so that we know these are the critical commodities that you require. You are talking about the health financing structure, where we are talking about these facilities. Once NHIF gives money, for example, to public hospitals, where does the money go? We have a system of ring-fencing these funds, so that the funds are deployed in the health sector. The funds are deployed in the hospitals. These are conversations that has been ongoing. The issue of health infrastructure, the MES equipment project, is part of UHC. That you can't have UHC, and when I prescribe for you a CT scan, you have to travel to Kisumu from Kitale to get it done. That is not. So this is a journey that the government has invested in. I've talked about MES, and you talk about now the healthcare services. Do we have the service provider? Do we have the services? You talked about PET scans that are now available in only 2 facilities in this country. We are setting up cancer treatment centers in centers of excellence. We're talking about Mombasa, Nakuru, Garissa, Kisii, and Kisumu as part of a journey towards UHC. Then the most important thing, which all these things cannot work without, and now I'm describing the health as a system, the leadership and governance. We have to engage the county governments, we have to engage our development partners, we have to engage the civil society, we have to engage all the stakeholders so that their role, their organization, their coordination delivers this animal we are calling UHC, which therefore means that for NHIF to deliver UHC, it is a system-wide approach. We are working with other sectors for registration of citizens, for community mobilization, for advocacy. We need the media, we need the national government administrative structures, we need the county governments. So it is the approach is a multi-sectoral approach towards UHC. The most important thing, however, is to make the ordinary citizen understand the benefits of UHC. And our cabinet secretary keeps saying, find someone has a vehicle, they have insured it, and they have not insured themselves. And he actually says, that is madness. And indeed it is. And that is what we need to tell Kenyans so that they know when you are covered, when you are insured, and he has mentioned the benefits, you are likely to be more productive, you are likely to build your wealth without having to worry about being impoverished by health.
Now, in line with helping Kenyans understand why it's important to just ensure your health, that brings us to the NHIF Amendment Bill of 2021. It was passed by the Parliament, and something that also the President acknowledged that is a step in the right direction. Now, there's some aspects of this bill that, some Kenyans had concerns around, and that's what I'd like for us to talk a bit about. And number one, some was saying that it is unfair to require all households, including the poor, to pay the premium, bringing in the aspect of mandatory membership. Let me come to you, Gilbert. This aspect of it being mandatory in line with UHC, how is that important?
Thank you, Jain, and thank you, because one of the key things we are currently doing is sensitizing Kenyans on the benefits of the NHIF Amendment Act 2022. Allow me to use an analogy. A story is told whereby a company in the US employed a sales representative to go and market some health juice. And in the first 3 months, the salesman could not be able to sell any juice. And when the management sought to know why there were no sales, the sales representative informed them that he was selling juice. And this is what the management told him. Do not sell the juice, but sell the benefits that accrue from drinking the health juice. And in a nutshell, he became one of the best sales representatives for that company. What am I trying to say? I want to appeal to Kenyans to look at the NHIF Amendment Act 2022 from an holistic perspective. Let us focus our attention on the benefits that accrue from the passage of that act. And I want to call it the act of the century, because remember, from 1963 to date, it has taken 60 years plus for us to be able to have a bill that domiciles universal health coverage in this country. But I'll go to where the rubber meets the road. What are the key areas of amendment before I answer your question? Number one, the name of the fund. Number two, sustain to being a strategic purchaser of healthcare services. And I mentioned earlier on the mission of NHIF to provide affordable, to contribute towards universal health coverage by providing affordable, accessible, sustainable, quality healthcare through strategic risk pooling and strategic purchasing of healthcare services in collaboration with the stakeholders. At NHIF, we realize that the customer is the king and is always right. Number four, protecting the interest of the contributors. And finally, improving governance and representation of stakeholders. I want to tell Kenyans, indeed, we've come from an area of challenge and a bit of controversy. Wanasema, mgalu mnyonge, lakini haki yake mpe. Yes, we've had challenges in reputation, going to some errors of omission. But all is not lost. In the new dispensation,
yes,
stakeholders presented their opinions to the Health Financing Report Expert Panel. And what came out that there was need to improve the governance structure of NHIF.
Okay.
Now, I'll go to the key areas of improvement and break them one by one. As earlier mentioned,
in a condensed form due to the interest of time.
Yeah, first of all, I'll start with the name. The name, the National Hospital Insurance Fund, has ceased to exist after the amendment bill was accented by the president. In place, we have the National Health Insurance Fund. Okay. What does it mean to Kenyans? The new name is a reflection of the true mandate of NHIF, which must be broader than payment of hospital bills in order to sustain universal health coverage. The other bit, expanding healthcare providers on what can be empaneled in NHIF. Remember, we used only to empanel and contract hospital. But in the new dispensation, we have taken cognizance of the entire healthcare ecosystem. We are talking of empaneling specialized services. We have providers who only offer, for example, diagnostic imaging. And for the first time, they've been catered for. The second bit is the mandate of the fund, whereby we are talking of empanelment and contracting, which enables the fund be a strategic purchaser of healthcare services.
Yes.
Previously, we used to be a passive purchaser. We've moved on to a strategic purchaser of healthcare services. I come to the key one that you've asked, sustaining UHC. It is not enough to pass the UHC bill, but where the rubber meets the road is how do we ensure that UHC is sustained for posterity of this country. And the new legislation has provided that for those who can pay, let them pay. For those who cannot pay, they will be identified and subsidized by the government. The question you asked is, why are we making it mandatory?
Yes.
Remember, the definition of universal health coverage is ensuring all persons have access to the much needed healthcare services that is preventive, promotive, rehabilitative, and curative without exposure to financial hardship or catastrophic out-of-pocket expenditure. The key word is all citizens. How do we ensure everyone? Honestly speaking, for the people who are in gainful employment, either by being informal or informal sector, who can be able to pay. And I speak from hindsight that health is wealth. Let them be members.
Okay.
For those who cannot pay, the government has put into place adequate mechanism to be able to cater for themselves.
All right. Now, let me bring in Dr. Andrew at that particular point. The other aspect of this bill, which I believe you can also just share with us your thoughts, was in regards to the those with private health insurers as well. And looking at this particular bill, they will be required to bill their other private insurer first before they come to NHIF. Why is this important for the ministry, for NHIF, and overall speaking, for the proper delivery of UHC?
I think I'll start by saying, again, the issue of benefits for indigent and mandatory payments. He has mentioned it, and social protection in this country has been ongoing. We have had programs, even under NHIF, targeting the vulnerable, the poor, who cannot afford to pay.
Yes.
Currently, I think we have several programs that are running, and what the ministry is doing is to working with social protection. We are able to identify indigents who cannot afford. But for people who cannot afford, who can afford, we are saying it is mandatory to pay. Before this question, I talked about people who are able to insure a car. That before you get your business license, for example, you are running a business. You need to have the government is trying to get a mechanism to ensure that you can or you should be able to prove that you are a member of NHIF. If you are buying a car, if you are paying insurance for your car, you need to show proof of insurance. And this is now the regulation. And I am preempting what the government intends to do so that we are able to identify those who actually cannot afford. And we have many mechanisms because it's unlikely that you are able to pay and you have money and you don't interact with government because you will be KRA returns, all those things. We are able to know this has the ability to pay.
Yes.
So those ones, we are going to ensure that those who can't pay, the government through the social protection mechanisms is going to pay for the indigents. And that has been ongoing. I think over 1.2 million households have now been enrolled. Households that are unable to pay have already been enrolled. And these will grow. I think the total number of indigents is estimated to be about 5.2. And there will be an annual assessment so that we know who has grown out of poverty. Because I was in the university and my family probably was poor when I was in the university. But when I start earning, then the family has moved out of poverty. So, we have to look at that dynamism of moving in and out of the indigent group.
Okay.
Then the other issue that you addressed is about now the amendment to the Act, which I said, like he has rightly mentioned, the Act now gives NHIF mandate. First, to develop regulations, mechanisms of ensuring that they pool as much resources as possible and move from what he has mentioned, from hospital to a health service as a ecosystem provider, a strategic public health purchaser.
Yes.
What are we saying? We are saying, and I mentioned about screening. When you look at the incidence of non-communicable diseases, cancers, diabetes, hypertension, probably if NHIF became passive as it has been and wait for the patient to come to the hospital, we will never manage that. But in the new NHIF, we will be able to say, how can we reverse? How can we stop the diseases before they come in? So health promotion comes in, advocacy, education becomes part of the benefits that citizens are able to get through NHIF. So in other words, this change, amendment in law now opens up the NHIF to actually deliver health as what health.
All right.
Health is not just the absence of disease. Yes.
All right, and that is a definition that most people get wrong. Yeah. Now, as we bring this conversation to a close, due to the interest of time, once again, let me start with you, Dr. Andrew, looking at further enhancing the sensitization and awareness levels among the population, excuse me, when it comes to UHC. What would be your recommendations to all the anyone who has a role to play in the value chain, and especially targeting the common man in chief? Very briefly.
Thank you very much. As the Ministry of Health, we have an army of 90,000 community health workers, volunteers across the Republic of of Kenya, and we are going to work with these community health volunteers and workers across the country, first to reach out to communities at the community level.
Yes.
We are working with national government administrative structures to ensure that the Nyumba Kumis, we message this message to the citizens. We are going to use the media to reach out to the citizens. We are going to use both media in print, in electronic, social media, all forms of media to reach out to the citizens. We are going to actively move out of our offices and engage the community to ensure that as many people first understand what this NHIF. And the most important thing is to bring out to Kenyans that the NHIF, and I repeat this a million times, the NHIF that they were talking about or they have thought or interacted with in the previous years is not the NHIF of today. The NHIF of today is from organizationals, from responsiveness in terms of payment of claims, in terms of the services, the benefits.
The delivery process.
Yes, is a different NHIF. And that is the message that we are telling Kenyans, that it is important to register to NHIF so that you should not worry about your health. You should worry about your other human needs and not health.
Gilbert, as we close this conversation very briefly, we have about a minute to go. What needs to be done to ensure awareness among the population in line with UHC and NHIF is going higher and higher to just ensure also with the delivery when it comes to your part?
Thank you, Jane. At NHIF, with our principal, the Ministry of Health, we've put into place an elaborate program to roll out or activate UHC in the counties. Remember, on the 7th of February, His Excellency the President launched
the national
rollout of UHC in Mombasa County. And we are still continuing with the momentum. Plans are advanced that we will visit the remaining 46 counties for purposes of activation of UHC. The activation will include, among others, engagement with our customers and our members. And when I talk of our members, both the Supercover members, Enhanced Scheme members, and the indigents, we shall be able to demystify, break down the benefit package, so that Mama Mboga back in the village can understand what is his entitlement when it comes to beneficiary, the scope of benefit package. We are also actively involved in the print and electronic media, and we want to thank KBC for hosting us this morning, whereby we are using these forums to reach out to the public and sharing with them what is happening at NHIF. It is the mandate of NHIF to sensitize its members across the country.
All right.
Yeah.
And this is also in line with sensitizing you as a Kenyan citizen to better understand what UHC is all about and the strategic role that NHIF has to play when it comes to the national delivery of universal health care coverage, however best resonates with you. This is why we are having such conversations. But for now, we have to pause at that particular point. We have once again been speaking with Gilbert Osoro, who is the manager in charge of Universal Health Scheme under NHIF, as well as Dr. Andrew Mulwa, who is the director in charge of medical services in preventive and promotive health under the Ministry of Health. Thank you very much, gentlemen, for being with us this morning.
Thank you very much.
Karibu sana. That is that. We want to bid you goodbye, but be sure to join us again tomorrow morning here on Good Morning Kenya. On behalf of the crew, I am Jain Wambui. Do enjoy the rest of your viewing.